hospital, you go to the emergency department, you got wound, and perhaps the wound is dirty and is not healing well. And the surgeons would perhaps want to scrape it, you get what I mean, to make it clean the dirty, and it's going to be very painful. That's exactly what happens during psychotherapy, especially people that have experienced trauma. So you bleed within yourself. Like, I don't want to talk about this, Dr. Adiola. Can you just leave me alone? But then I know that that's when the healing comes.
Here
Hi.
Hi. Finally.
Finally.
Yeah. How are
Good
you?
evening. I'm good.
That's
And
good.
you?
I'm well. You know, dealing with that end of year stress, the holiday stress, but you know,
yeah.
powering through. Powering through. It's nice to meet you in person. Well, virtually.
Virtually, but live, right?
Yes. So
nice to meet you. Hi, everyone.
I am excited. So pronounced. I mean, I'm familiar with a lot of African names. You can see my name is Aziza Kibibi, and I know an Adiola. So, but is your last name pronounced Adeyemi?
Adeyemi, yeah.
Adeyemi. Okay. All right. Beautiful. Beautiful.
Thank you.
So tell me a little bit. I was just sharing with the audience some of the things that you do, what you focus on as far as, you know, mental health, as a mental health professional. But you know, there's nothing like getting it from the source. So tell me about some of the things that you specialize in.
Excuse me. Thank you, everyone. Thank you, Aziza, for having me here. Nice to meet you, everyone. I see my people. I see Okwe. I see a lot of people saying, hello, Dr. Adeyemi. Yeah. So I'm Dr. Adiola Adeyemi, and I'm the founder of Talk Mental Health. I'm a mental health professional. And what that means is that I graduated as a medical doctor, and then I went into psychiatry specialty to specialize as a psychiatrist. We took about 6 to 7 years to get that specialty, and now I'm a psychiatrist. I did that back home in Nigeria. I was born and bred in Nigeria, but now I currently live in the UK. So I moved into the UK about 2 years ago, going to 3 years now. And I'm also on another journey of specializing in another part of a subspecialty in psychiatry. Anyway, so that's me basically. So what psychiatry is all about is mental health. I think mental health is now very popular, and people are now aware. They know what it means. They may not be so familiar with the word psychiatry, but I think mental health is more familiar to most people. So yes, mental health, it's all about your mind. What I do, I deal with people that have got mind issues. I work with clients that have got mental health problems, mental health disorders, whether you have a diagnosis or not, whether you're struggling in your relationship, whether you had childhood traumatic experiences. I help people heal from their past traumatic experiences through psychotherapy sessions. And you know, if you've got relationship issues, I also coach people, you know, people that have gone through my profile. They've seen how I've been able to, you know, my resilience journey of medical school story up until when I moved into the UK, and the hurdles I had to face and how I was able to overcome that and build my own resilience. I used that same experience I've got. I try to coach people on how they can also overcome their challenges as they journey through life. So yes, I'm a mental fitness coach. I teach people how to become self-confident, you know, how to be their best self, how to be authentic, how to be audacious. So that's it. That's all
Okay. Awesome. Now, I just want to tell the audience, please share the live with anyone that you think that could benefit from this conversation. And if you want to ask a question, definitely make use of the little question symbol down at the bottom, and I'll be checking questions because it's kind of difficult to keep up with comments. So do you prefer Dr. Adiola or Dr. Adeyemi?
Dr. Adiola is fine.
Dr. Adiola is fine.
Yeah.
Okay. Do you ever get anybody ever call you Ade for short?
No, I prefer
No?
Adiola. So you call me Adiola or you call me Dr. Adiola. I don't like Ade or
Short names. Yeah. And I mean,
I just
I
want
don't,
my name to be
yeah, and you
pronounced
know,
that this is who I am, basically.
right,
I'm not
exactly,
to be who I
exactly.
am.
And exactly. And I know it's kind of I can't even say it's an American thing, but I feel like a lot of Southerners, well, no, let me not say that, because I think West Indians do the same thing. Because I had an aunt who passed away of breast cancer recently, and she immediately wanted to shorten everybody's name. So I wasn't asking you so I can call you a day. I was just asking if you did have that nickname, but I'm
Yeah,
all for completely.
Aziza, I get a lot. I work in the UK, so the first thing is, do you want me to call you Adi? I said no, Adiola.
Right.
It's
And
just Adiola. It's simple, like it's not too long.
right,
Adiola.
it's not. It's not. Oh my gosh, the way people butcher my name. I've been called Aziz, Azizi, and I'm like, you
I
do
can
know that
imagine.
those are whole entirely different names, right?
Different names. Aziza
Yeah.
is not difficult to pronounce. I don't know why is it difficult. You can learn
Yeah.
the name. Yeah.
I don't know. It is what it is. But I'm like, no, Aziza is fine. Thank you. Thank you. So could you explain for the audience, what is the difference between psychiatry and psychology?
Hmm. Hmm. Okay.
Because I've
So
heard of psychiatrist and then I've
yeah.
heard of psychologist.
Yeah. So, psychiatry, it's a profession that doctors can go into, basically. So, psychiatry is like a subspecialty in medical field. So, if you want to go into a subspecialty in medicine, in the field of medicine, we have different types. We have cardiology, which is there are doctors that deal with the heart. We've got ophthalmology, the doctors that take care of your eyes. We've got neurologists, the brain doctors. We've got what else? Endocrinologists. I'm trying to remember. Okay, obs and gynae,
Right.
and obstetrician and gynecology. They are
Gyneco-
the that do the women and childbirth and all. Pediatricians, yes, they've got. It's been a while. I left medical school since 2010, so I'm
I
just
know
trying
there's
to.
a lot of
Yeah,
them.
so that's a whole lot. So psychiatry is also like a subspecialty, like in that category that I just mentioned. So
Okay.
basically, it's just you have to become a medical doctor. You must have trained in medical school to become a medical doctor before you can then go into that subspecialty as a psychiatrist. There are different courses, psychiatric courses, but it doesn't make you a psychiatrist, if you get what I mean.
Okay.
But
Gotcha.
psychology is a course. It also it's related. So psychology has to do with the mind as well. It's related, but anybody could pick up the course. You can do masters in psychology. You can do clinical psychology, and then go into that and then do it for 2 years and you become a clinical psychologist, or you become different types of psychology that is available. But what I'm saying is that even as a psychiatrist, you can decide to go and study clinical psychology and become a clinical psychologist. Add that to your achievement as a doctor. So, but all I'm saying in essence is that if you want to look at it in terms of who is who, you have to be a doctor before you can become a psychiatrist.
Gotcha.
And you don't have to be a doctor to become a psychologist, if you get what I mean.
Oh, okay.
Yeah.
And
So,
is
but
that
but
why?
then what we do is related, closely related.
Right.
So, as a doctor can prescribe.
Okay. Right. That's what I
Yeah,
was
a
going
doctor
to
can
ask.
prescribe, but a
Right. Medication.
psychologist may not be able to prescribe.
Okay.
So
I got.
a psychologist will just do talking therapy and all those kind of therapies, but a doctor will treat in terms of treating and giving medications to patients.
Okay.
Yeah,
Okay. I
yeah.
understand. So, what made you decide to go into your profession?
Oh, it's a funny question, and it's going to take me back the memory lane. So
we love stories here.
honestly, yeah, I love sharing my stories. I mean, for those who follow me, they know that my stories out there on IG. I don't keep my stories from people because I believe I inspire others by sharing my story, which is what I like. What you do, Aziza.
Yeah.
So for me, medical school was very long. It was very long. I trained back in Nigeria. There were industrial strike action, a lot of issues. So it was meant to be for 6 years, and I ended up spending about 10 years in medical school, extra 4 years.
Okay.
So I was already tired and bored. I've been through medicine, I've been through surgery, the rotations, I've been through pediatrics. They were very stressful. I didn't like ONG, that's obstetrician and gynecology, obstetrics and gynecology, right? So I didn't like the blood, I didn't like the sight of blood, I didn't like surgery, the crush injuries and all. Just didn't like them. But I had to go through them. And it was my final year in medical school. That was when I was meant to go through psychiatry posting. And I went there. And I was like, wow, so this subspecialty exists in medical field.
Right.
The ambience, the fact that we all sat down during ward round, it has never happened. You will stand for 5 hours for ward round. It was exhausting, it was tiring. I didn't like it.
Right.
But you see your consultant, the senior colleagues, they were just laughing. Everybody is so calm. Everybody is happy. I love that about psychiatry. And then I just made up my mind that this is where I belong. I was going to go through, and I was so clear. And I am glad I did. I have never regretted choosing this field because it has helped me express myself. Like, I'm able to be a doctor and also be myself.
Right.
Nothing is really holding me back. Because if I were to be maybe a surgeon, perhaps I might not even have time to come on here, if you get what I mean.
Right.
In the operating room all day and not even have time for the social media. But what I'm saying is that being a psychiatrist, I can come out, I can advocate, I can create mental health awareness, I can speak to people, I can tell them a lot about mental health. So I love that, and that's why I chose psychiatry.
So it was your calling. It was your calling.
You get it. That's it. That's my point. Exactly.
Yeah, well, that's awesome. So you mentioned earlier about mental health kind of trending. I'm paraphrasing what you said, but you see a lot of people have become very much aware about the importance of mental health. You see it on social media, you see a lot of it just incorporated into more television shows and films. What do you think about how people intake the information on mental health and do a lot of self-diagnosis from reading things online? Do you think that is helpful? Do you think it's harmful? Can you make any recommendations to how it could be the most effective if you do, read information? And I mean, I believe information is power, knowledge is power, right? Yeah. But anything with power, you have to know how to use it. And so can you speak on how people can use this information, as well as your thoughts? Maybe you've had clients that come in and they've already diagnosed themselves with ADHD, something like that.
Yeah, thank you very much. This question is really important, and I like that you asked, especially because of where I'm coming from, Africa, when we think of mental illness, when we think of people that are struggling mentally, the picture I got, that I grew up with as a child, was different, totally different from what I've experienced through my career as a psychiatrist. So growing up, we see someone roaming out on the streets wearing tattered clothes. That person is named or tagged mad person, and then you automatically believe the person is dangerous and you're supposed to run away from the person. So these are myths. People believe that people that have got mental illness are dangerous. They believe that you don't want to associate with them. And the same thing is what we see in most of our movies. That's the kind of movie they narrate to us. They show us. They believe people that have got mental illness. No, even when you want to get married, you want to check have they got mental illness in their family. You want to be careful. You don't want to be associated, nothing has to do with mental, people that have got mental illness, basically.
Mm-hmm.
So that's what I believe, that because of that culture and what we know about mental illness from years back, is why people stigmatize and discriminate against people that have got mental illness. But I'm grateful that the social media, especially since pandemic, things changed. People become more aware of mental health. People are now coming out to say, I'm struggling. People are less, it's still there, but it's way better than what it used to be.
Mm-hmm.
And it's good. That's the positive. People become aware. They know that, oh, I've got low moods, I've got loss of interest, I've got decreased energy, perhaps I'm depressed. In fact, people can even use the word like I am depressed when they feel sad, meaning that, oh, they use the diagnosis of depression as a terminology to depict that they are sad.
Right.
I think it's incorrect, because that you are sad does not mean you're depressed.
Right.
Sadness is just an emotion, but it does not translate to depression. It just means that you're probably temporarily, feeling low in your moods. And for you to have depression, there has to be persistent feeling of sadness for at least 2 weeks.
Oh, for 2 weeks. Okay.
2 weeks, yeah.
Okay.
So it is a clinical diagnosis. So I tell people that don't use that term. Don't say I'm depressed or you're feeling sad. That's you're feeling low. The fact that you're feeling low does not mean that you're depressed. You have to see a psychiatrist, a therapist, and get yourself diagnosed before you can then come confidently to say you're suffering from depression. If you get what I mean. So what I'm saying, I took you back to when I was growing up, just so that you can see how lack of information made us believe something else. That people with mental illness were dangerous and all. But now we have a lot of information. We have the knowledge, but perhaps we're not using it appropriately. So it's very important. It's important for us to get the information from the right sources. That's number one. Get it from the right sources. You don't believe everything you see on the social media. You don't believe everything you see on Google. You don't believe everything you see. Some people will say, oh, I'm having anxiety. I'm having this and that. Am I hyperactive? Then they go on Google to try and check the symptoms and come up, yeah, I've got ADHD. Oh, my daughter has got ADHD. My son has got ADHD. Or because of this and this, it's anxiety or this and that. You can't do that. You have to be seen by a specialist, because the truth is, for this field called mental health, the mental health field, we don't usually have like how do I say, investigations like blood tests, if you get what I mean. Blood tests that would make the diagnosis of mental illnesses. Right. For instance, if a person has got heart problem, you do perhaps like an ECG, like a heart test to check whether there is the disease there. Right. But for mental health, because we have been trained to speak to people, to tease out the symptoms and come up with a diagnosis, you can never get that same thing by self-diagnosing yourself, by going on Google, something that we have been trained to do for 6 to 7 years. So you get what I mean? Right. So if you are self-diagnosing yourself, you're probably going to get the wrong diagnosis, perhaps self-medicate, which is not necessary. Put yourself under undue stress because you feel agitated, thinking you've got this when you don't even have it. So my advice for people is, yes, get the knowledge, be aware, but don't conclude. Go to the right sources, go to the psychiatrist, see a specialist, and get the right diagnosis. Don't self-diagnose.
Okay. All right. I completely agree with you. I do think, there's a wealth of information out there, but there are also people that are putting information out there for likes and shares. So, it is important. Yeah, it is important to go to sources like yourself to get information information and cross-reference. I tell my daughters that all the time, especially my younger daughter. I'm like, you have to cross-reference your information from a reputable, cross-reference that information with a reputable source. So when it comes to, I'm not sure how it works in the UK, right? But I know here, especially in low-income communities, it's very difficult for people who live in poverty to pay for mental health care. What in the UK and even in Africa, if you can speak on a little about what the system is like there when it comes to treating mental health and mental health disorders, and also if you can you recommend for people who don't immediately have access to mental health resources that they cannot go to see, they could not afford to go and see or speak to a psychologist or psychiatrist, what are the things that you would recommend that they do?
Yeah. So thank you, Aziza. So in Africa, in Nigeria specifically, where I trained, there's still out-of-pocket payments for people suffering with mental health issues, and which is really sad. People would have to still pay. So yes, that affects most people coming to the hospital. They would only come when things have gotten out of hand, when they can no longer cope. So many times I've seen cases when I was in Nigeria that they would say, oh, I couldn't come, I can't pay for the consultation, I don't have money for this, I don't have money to buy medication. So there's poor compliance due to lack of funds. There's, what we call relapse. Relapse is the illness coming back again because patient has been away from treatment for long. There's a long duration of illness. So illness being there, the symptoms persisting for long before they come, just because they don't have enough funds. They're like, oh, where do I get the funds? So they keep managing at home. So that's in Nigeria. But here in the UK, there's a health insurance system, the NHS. So I think that helps here in the UK. People get free treatment, free mental health treatment. I know that the triage UK, in terms of how severe it is, they want to check the risks and they want to see if the person is at risk to himself or to others before they bring them into the hospital. But there would always be a form of treatment, if you get what I mean. So it's said that somebody is coming home to check on the person, treatment in the community, and when it becomes really worse, they bring the person into the hospital.
Right.
That said, there's still a long waiting list. For instance, people that need talk therapy, psychotherapy, there's usually a very long waiting list because it's assumed that for you to engage in psychotherapy, you have to at least be stable. So there's a long wait. It's not an emergency, if you get what I mean. So there's a long waiting list. People are usually they're kept on the waiting list for up to like 6 months sometimes for them to be able to see a psychologist because we don't have enough of them here in the UK. So that's that about the question. I know that in the US, Aziza, are you in the US, right?
Yes, I'm in the US.
So in the US, I think what you said, it's similar to what applies in Nigeria. You have to have your money either you have insurance or you have your money to be able to pay for medical treatment. So yes, that's that about that. Which is sad. I think it's not a good one. It's not good.
And I think the powers that be, like the systems that are in place, because they're just catching up with the idea of the impact of mental health on our society in general. I do think it's becoming maybe a little easier, but the thing is, there's the welfare system, and you can get health care through the welfare system. However, there's a lot of stigma associated with being on welfare, so that's a deterrent from people. And they've expanded some of the income limits for you to get Medicaid and free health care, or at least discounted health care, but it's still the cultural stigma still prevents a lot of people from applying for the welfare, essentially. And then because of the stigma, especially in the Black community, associated with getting mental health care, we, with my organization, Precious Little Ladies, we have partnered with BetterHelp which is the online talk therapy. I don't know if there's access to it in the UK, but here in the US, there's a company called BetterHelp, and it's online talk therapy. You have access to over like 60,000 different mental health providers. And we've partnered with them to provide free mental health services to women in low income and marginalized communities. However, I thought that there would be like this huge response once it was announced, but there isn't, because there is just the cultural association, the cultural stigma.
I'm here.
Okay. No, I got a phone call.
Oh, okay.
Yeah. Associated with even getting mental health care, right? And I think it does lead back to what you were saying, how in Africa it was kind of looked at, well, people with mental health issues are dangerous or they're scary, right? So no one wants to acknowledge that they may have some kind of mental health issue, or they need to take care of their mental health in order to thrive in their life. So, you know, it's there's so many layers and so many intersections.
Yeah, I agree with you. I mean, like when you mentioned that people are not even turning up, I suppose what your organization is trying to do, I mean, it's a free online service, online mental health service, I suppose.
Right, yeah.
Yeah, so I'm having the same challenge as well. We had our end of the year. By the way, I've got my organization. It's a non-governmental organization, Talk Mental and Emotional Health Foundation. We offer free counseling, online counseling for people. And we've noticed that many a times when people book for the sessions, few hours to the sessions, they just cancel.
Wow.
It's free. I mean, people will tell me, oh, mental health therapy is expensive. Yes, now we have free counseling. We offer free counseling sessions at Talk Mental Health, but they are not showing up. So what's going on?
Yeah, I don't know what it is. I don't know. Have you ever heard, even in marketing, they say that when you give something away for free, that people don't see its value because it's free?
Yeah, I understand. But
so I'm wondering, is there a little of that going on?
Well, I think for mental, that might be the reason. That might be one of the reasons, Aziza, that perhaps because it's free. Another could be that people that are struggling mentally, you know, it takes a lot of courage for them to be able to come up to say, I've got mental health problems and engage. And for everyone that would engage in therapy, they have to be psychologically minded. What that means is that they have to have a level of insight and be ready to engage. So a person that have got mental health problem and is still that they have altered reality, they are not themselves, they are hallucinating, they are, you know, there's a problem with reality. They may not be able to engage in therapy, if you get what I mean. Yeah. So you might still be experiencing some of the symptoms, but you are still able to engage. For instance, during therapy, they will give you exercises to do, they will tell you to do something. You should be able to do them. But if you're not able to, perhaps you're struggling to stand up, get up from bed, you're still unmotivated, you're still struggling with all of those things, you may not. Yeah. And if you've got some people have the struggle with a mood disorder, bipolar affective disorder, for instance. So sometimes their mood is low, sometimes their mood is a bit high. They might book the session when their mood is high, and when the time for the session comes, their mood dips and they don't want to engage. You know, anxiety is also one of the reasons why people would cancel just before the session. So it could be because, of course, maybe it's free. That's why people are not engaging. It could also be because they are not up to it yet. They're not ready. Yeah.
Yeah, you're right. And one of the feedbacks I have gotten is that it's easier to talk to me as a survivor than it is to talk to a professional who has not been through the experience that they've experienced.
Yeah.
You know, so maybe that going back.
That's it. Yeah, I mean, one of the things, some people find it difficult to connect with someone that feels strange to them. Yeah. And that's why in therapy, we want to build something we call therapeutic relationship. So the first few weeks, you want to ensure that there's a connection between you and your therapist at first. before you can go deep to say you've got this, you've got that. You can't just open your mouth and say stuff that are deep within you if you don't feel connected to a person.
Yeah, yeah.
Yes, you're right.
And I think it's important for people to realize that, yeah, how they feel about the person that is going to help them heal is very important. It's almost like it's a mutual interview. Like that first visit is like a mutual interview. So I always recommend, like, look, if it doesn't work with the next one, then with the first one, then go to the next one. And I know that could be daunting and exhausting on its own, but you have to prioritize yourself. You have to prioritize yourself and put the work. So, okay. So what are your thoughts on, there are so many different types of therapies. Have you ever heard of a book called The Body Keeps the Score?
No, I haven't.
There is this book, this doctor, he's actually from the Netherlands, but right now he has a research center in Boston. His name is Dr. Bessel van Kalk, and he does a lot of studies with the impacts of trauma on a person's ability to achieve self-actualization and thrive in their life, and how debilitating trauma can be and why that is. So he talks about all kinds of therapies, from yoga to EDM. I mean, I'm not sure how to explain what EDM is. You probably know more than I do. To using psychedelics, and of course talk therapy, psychotherapy. And he talks a lot about how the severity of the trauma, he does focus on sexual abuse, how different therapies work differently for different people. What are your thoughts on talk therapy versus other kinds of therapy that you have had experience with? Have you ever tried EDM or even hypnosis? Because I know some people, some psychologists even use, or maybe a psychiatrist even use hypnosis to have the person regress back into memories that they are afraid to confront. What are your thoughts on that?
So for me, I think talk therapy is more popular than the other forms of therapy. Perhaps because people are finding it a bit easier. Most specialists find it easier to engage in talk therapy. We've got different types of talk therapy. It could be cognitive behavioral therapy. It could be individual therapy. It could be there are different types. Let me not bore you with all that's anyways. And for talk therapy, one thing I know for sure about talk therapy is that, like I mentioned earlier, you have to be psychologically minded to engage. You have to be willing to engage. There has to be motivation, if you get what I mean. I mean, talk therapy, you have to be able to get up, engage. Perhaps if it's online, log in. If it's physical, attend, come. So if you're missing sessions, if you're unable to log in, if you're given excuses, then you're not ready for talk therapy.
Yeah.
But the other forms of therapy, some people still, they're not ready to talk. They're not ready to share their experiences. Like we mentioned, the therapeutic relationship, perhaps they've not connected with the therapist, perhaps they're still dealing with their past traumatic experiences. They're not there yet. But other forms of therapy like hypnosis, EMDR, they don't usually involve too much of talking, if you get what I mean.
Right.
Yeah, so for some people it might be something to start with, like, okay, let's do EMDR for someone that's struggling with post-traumatic stress disorder due to trauma. EMDR is just you have to talk just for a while, just a little bit of getting to know what you're struggling with, not going deep, like what would happen if you are talking, in talk therapies. And you then talk about eye movements, or, ensuring that the right part of the brain and the left part of the brain are working at the same time while the person focuses on one trauma, from there they move to the next. So it does not involve talking. For some people, it might be easier. So if you get, I feel like for some people that are not ready to talk, but they really need therapy, they might engage in the hypnosis or EMDR before they can then now are ready to talk, like really talk about what they're going through. Because sometimes talking can be very challenging. Getting so deep into what you've experienced in the past some things that you've kept away from your memory. You perhaps said that you were not going to go back to it again. It's very difficult for people to talk about what they've experienced in the past, like you do, Aziza. And I'm sure that you must have experienced some trauma, I mean, trying to relieve the memories of what you went through and all. So some people are not ready yet. So that's why I believe that, yes, the other forms of therapy can be helpful for those people at that time as they're struggling. And for some people, we give medications just so that they can cope with the anxiety at that time before they now mentally ready to go through talk therapy.
Yeah. It can be a very daunting process. A woman came up to me who recognized me from television, and she was full-fledged crying, and it startled me at first because I didn't know why. And then she couldn't talk, and she was like, I know why, and she kept saying it, and I was like, okay. And then she just kept saying thank you, but she was crying so much that it wouldn't even fully come out, and she just kept repeating, I'm not ready, I'm not ready. You know, so that was the first time that I experienced in that way someone who you could see wanted to get started on the healing journey, but was too afraid of what comes along with it. And it was heartbreaking, but I know everybody, you know, they get to that place in their own time. So, yeah.
And the thing is that, I mean, it's okay for people to heal when, I mean, healing, it's personal, if you get what I mean. Like, take your time whenever you're ready. But then the truth is that anytime you're ready, you still go through. It's not comfortable. It's not going to be easy to do. Therapy is not, I mean, I've had to do therapy. We call it psychodynamic psychotherapy for someone for a whole year. And most times during the therapy sessions, the person would just start crying and, you know, and I just had to let them cry. You know, we're bringing back memories of what they've experienced in the past, things that they've repressed, they don't even want to talk about. I'll be like, let's go there. That's what I want you to talk about. Because the next time you then remember this, you will not attach any importance to it anymore because you've spoken about it. You started to heal. It's just like physical wounds when you go to the hospital, you go to the emergency department, you got wound, and perhaps the wound is dirty and is not healing well. And the surgeons would perhaps want to scrape it, you get what I mean, to make it clean the dirty, and it's going to be very painful. It will even be bleeding. Some people might even say that, why not leave it that way? But you know that it's going to get infected if you don't heal it properly. The healing would not be good enough. It will, you know, it perhaps will leave scar. And you might not even, you might even, sometimes you have wounds that will heal facially, I mean superficially, but deep down you still feel the pain. So you need to remove, we call it debris, the terminology is called debris, that we remove the dead tissues and, you know, scrape and scrape, it bleeds. That's exactly what happens during psychotherapy, especially people that have experienced trauma. So you bleed within yourself. Like, I don't want to talk about this, Dr. Adiola. Can you just leave me alone? But then I know that that's when the healing comes, because it's not going to be comfortable, but in the long run, you're going to be happy you did.
Yes. I always say change is not made in comfort zones. And I love the analogy that you gave, associating it to physical wounds, because everybody knows you get a cut, you get a wound, it hurts healing it, and it applies the same way. But you know, you have to be brave. Really, it requires.
The chocolate.
That's my daughter.
What's her? I won't keep you too much longer. So I just want to update everyone. I am here talking with Dr. Adiola Adeyemi from Talk Mental Health. She is a psychiatrist, and she is so knowledgeable. And I admire her very much in her work. We do have a question. Mike Eddie 1441 asked, how do I deal with anxiety and anxious thoughts?
So, Mike, one thing I want you to know is that everybody has got anxiety. So go meet grandma. Go meet grandma. Bye. Shut my door. Thank you. So, the first thing is for you to know that everybody has got anxiety. So when we hear the word anxiety, it doesn't mean that it's a disorder. It's just a normal response to whatever it is we're going through, every life's challenge, like everyday life. You feel anxious. Even before I started this life, I'm like, oh, something came up. I have something to do. I have a session where I have a live session with Aziza. I wouldn't call it anxiety, but of course I know that I'm a bit anxious. Like I have this.
Right.
Do you know what I mean? Something is coming. So if I've got an exam coming, I would definitely anticipate and be a bit anxious. If I have to go to work very early in the morning, I wake up, I'm like, oh, I'm going to work. Rather than on a day when I won't go to work, I'll be more relaxed. So
Right.
one thing I want you to know, Mike, that anxiety is common to all. It's everybody that experiences it. It's only when it becomes excessive, when you feel really anxious over nothing, when there's nothing that is supposed to bother you, you're worried about everyday life, then it becomes, and it's affecting your ability to function. Perhaps if you're supposed to go to work, you can't go to work because you feel anxious, then it becomes a disorder. All right. So one of the ways you can deal with anxiety without even using medication is first, breathing exercises. Deep breathing exercises can help. So, for instance, you have a presentation and your nerves are getting at you, then you can breathe in and out. Do deep breathing. You have 6-8-8-4 breathing. A lot of it's on YouTube that you can learn. Breathe in for 6 seconds, hold it for 8 seconds, bring it out for another 8 seconds. So that could help relieve your anxiety. Another thing is your everyday life, like your habits. You don't have to wait till you become anxious before you do these things. Sleep well. Ensure that you are doing 7 to 9 hours of sleep every day. Hydrate yourself. Movement is very important. You don't have to go to the gym. Just ensure that you do 30 minutes of movement every day. Move your body, stretch and all. Mindful meditation, very important. Practicing journaling. All of these things are not expensive, if you get what I mean, but it's very difficult for people to stay committed to these things.
Yeah.
They are very effective if you are intentional about doing them. So ensure that you set aside time every day to practice mindfulness. Ground yourself in the moment. Ensure that you breathe. Ensure that you do breathing exercises regularly. Sometimes I recommend that my clients do it like they're taking medication 3 times daily. You have to wait till that anxiety comes. Do deep breathing exercise in the morning. You can do it in the afternoon. You can do it at night. So maybe for 1 minute in the morning, 1 minute in the afternoon, and then at night as well. Walking in nature, all of these activities can help. Then if you have recurrent negative thoughts, you have to be able to challenge these thoughts. So these negative thoughts keep coming to your mind. You first of all need to understand that your thoughts aren't always true. So if it comes to your mind, you need to remind yourself that it is not true. Then track your thoughts, write them down. This is what I'm thinking about. Then write the opposite. So for instance, you keep thinking that, oh, I can never make it in life. Then you write the opposite of what your thoughts keep telling you. Or I've never done anything good in life. Then you need to give yourself evidences, things that you've done that are good in the past. You need to remind yourself because our minds are wired, or human beings are wired to think mostly negative thoughts. So we are quick to forget the good things that have happened in our lives, and our mind is quick to remember just the negative things. Social media is not also very helpful because negative news flies so fast on social media, and people usually would only engage in negative gists, if you get what I mean. So you have to be intentional about what you hear, what you see, what you feed your mind on. Very intentional. Take try and reflect on what has been happening in your life, the people you surround yourself with, what are they saying to you? Because that's what definitely going to come to your mind. If people around you are usually always saying things that are negative, then most likely you are going to think negative thoughts.
Right.
I hope that answers your question.
I think you did. You did very well. And isn't that something, how we are, the negative things stick to us? It always reminds me of a scene in a movie called Pretty Woman, right? With have you ever seen it? With
No, Pretty Woman.
oh, who was the star of it? Anyway, it was a story about a woman who was a prostitute, and this rich guy, it was kind of like a Cinderella story, and this rich guy picks her up one night and he ends up making her his girlfriend. And the first time that they have sex, she's telling him her life story and her traumas when she was little. And I think it was her mother must have really just put her down over the years. And he asks her, why do you believe the negative things? Because he's like, beautiful, you're talented, you have a great personality. Why do you believe the negative things? And her response was, they're easier to believe. And I found that, I was like, when I first heard that, I'm like, isn't that something? Negative things, negative energy directed at you is easier to believe and absorb than the positive things. I think that is a phenomenon about the human species.
Yeah, it is. It is. We call it negativity bias, you know.
Oh.
So there's a bias that we have. It's just natural to all of us as humans. And we have to intentionally correct this bias, you know, because if you're not careful, you will only think of negative things. It will be easy for you to pick negative things. You forget that things have been good for you. You forget the good ones. We all have cognitive biases, and we need to learn to track, become self-aware, to know that these are the things I always think about,
right?
And this is what I can do to make the changes.
Right.
Yeah.
Exactly. And I just to segue, so I have two more questions for you. And I think that the next question pertaining to religion, I find that religion really uses negativity to scare people into doing the right thing, right?
Yeah, you know, right?
The book of Revelations have been weaponized. And I think that is like tying into what people will believe negative things and then get scared. And then, you know, the church, whether it be Catholicism or Christian Baptist, will then offer these solutions through Christ. What do you think? I mean, here, my family on my mom's side is West Indian. My grandmother's Jamaican. She grew up a devout Christian Baptist woman. And though, you know, my father, he explored a lot of different religions, he always challenged Christianity. And I find that in a lot of churches, one, we know even through the Catholic Church, through the Catholic Church, a lot of sexual abuse does exist. But I find in trying to go into churches to talk to them about sexual abuse prevention, because there's a lot of young girls who are looking up to deacons and pastors. A lot of the women in the churches take this perspective that God will handle it. It's in God's hands, or it's done, or it's being taken care of within the church. So what do you think about the spiritual approach, or the religious approach, I guess more, because I think spirituality and science and all of that is connected. And of course, we as spiritual beings having a human experience, based on my perspective, you know, you can't separate one from the other, but clearly religion has separated them. What do you think as far as, you know, covering it in the blood of Christ, that kind of attitude when dealing with life traumas?
Yeah, thank you for that question, Aziza. And you see, I'm laughing, I'm giggling. I know. I've experienced a lot of it.
Look at you, because I was like, you're gonna make me laugh.
Back home, even my own personal experience. Oh God, I've had my own personal experience of religion and beliefs in so many things about mental health, especially because, you know, most people that have got mental health symptoms, the first place they take them to is to churches. They pray for them, they do a lot of things, they do deliverance, and when the symptoms don't get better, they bring them to the hospital. So, and at that point, the symptoms would have, I'm very busy, the symptoms would have gotten worse, if you get what I mean.
Yeah.
So, yes, that aside, but I believe religion is not the problem.
Okay.
I think the approach, I think it's how people perceive mental health problems and how they use religion to, manipulate, I would say, some people. Because the fact that we can't always leave everything into God's hands. God gave us wisdom. God gave us this brain.
Right.
God expects us to be smart. We can't be praying, we can't just be praying and expect things to work, because the Bible even says that faith without work is nothing. So that there's a part of faith, there's a part of work, there's a part of prayer, and there's a part of your own work, the knowledge, the intelligence God has put into the minds of the doctors and people that are professionals. You get what I mean? So religion can be used as a way to create awareness about mental health. So I'm talking about the pros now. So you can use religion. People use religion as a form of hope. When it comes to church, they pray, they pour out their hearts. It's therapeutic. They see people, they connect. Good. It can be in denial if care is not taken. There's nothing wrong with me. Oh, perhaps this is what it's supposed to be. God will take care of it, like you've mentioned, and then may not get the help they need as quickly as possible. So it's very important that people, if you're watching this live or you're watching the replay, that you've got mental illness does not mean that you cannot pray and take your medications at the same time.
Right.
We are tripartite beings. Like, in my own opinion, I believe that everybody on earth, you've got three parts. You've got your spirit, your soul, and your body.
Okay.
So you need to be able to take care of every part of your being. If you continue to pray and pray and pray and don't take care of your physical body, your body will perhaps grow weak and tired and die. You will not have the house to keep your spirits. And that's when people die, right? You need to continue to take care of your body and take care of your mind. And that's why I'm a Christian, that's why the Bible has said in Romans 12:2 that we should not be conformed to this world, but be transformed by the renewing of our mind. So you have to work on your mind. The fact that you are a Christian and you're giving your life to Christ does not automatically mean that your mind is transformed. You have to do something about the mind. That's what the Bible says. So I believe that as a person, there has to be a balance. You can't focus on one part of your being. You have to make sure that you care for your spirit man, your physical person, and also your mental person.
Right.
So that's when people don't take care of their mental health, they come down with depression, anxiety. Even people do come down with schizophrenia, which is a psychotic disorder. They don't take care of their minds. So there has to be like a balance. If you're watching this live, just know that I need to care for every part of my being, the three parts of me: my physical health, my mental health, and my spiritual health. It is very important to ensure that we care for these three parts.
Yes. Very well said. Very well said. Thank you for that. Okay, so now let's get into you a little bit. I know your little ones want your attention, and it's late over there. It's getting late. What achievement, Dr. Adiola, are you the most proud of?
Okay.
What have you achieved in your life that you are the most proud of? Going back to, we have to acknowledge those positive things. You had to struggle. You did your work for your 7-8 years for you to get your degrees. You're doing the work. There are challenges. What are you most proud of in everything that you've done?
Nice.
What is
I'm
it?
proud of myself.
Backwards, because it's what is it? What's you? What is it?
You deserve bliss.
Okay, you deserve.
Oh my God! Sorry. Oh my God! My TV is.
Oh, it's fine. Go ahead.
Let me get my remote. Sorry, 1 minute.
Okay, so while Dr. Adiola is handling her television, I just want to update everyone that she is a psychiatrist, a mental health specialist. She's about to share with us her proudest achievement. And this has been an amazing conversation. If you have any questions, please DM me. You can DM. I'm sure she's going to share after she shares more information about your book, her book, how you can get in contact with her, and information will be on the replay. And take it away, Dr. Adiola.
Thank you very much, Aziza. So yes, this is my book, You Deserve Bliss. And it is a self-care guide to everyday fulfillment. The reason why I'm so proud that this is my first book anyways. The first book I wrote is on Amazon, is on our website. I wrote it it was published last year, September. So it's been a year that this book has been out, and it's transformed a lot of lives. So one of the reasons why I am proud that I wrote this book was because I wrote the book during one of the most challenging time of my life rather. So it was when I just moved into the UK. I said I trained in Nigeria. I became a psychiatrist. Then I relocated to UK, and then I had to start all over again, if you get what I mean. Trying to write exams. My little one that just came, she's now 3. She was 10 weeks old when I brought her to the UK.
Wow.
And I had another 4-year-old, she was 3 then, toddler. So I had 2 young kids. So I was literally breastfeeding my daughter in the call rooms during on calls. I was preparing for exams. I didn't have anyone around me. My partner, of course, my husband was here, but you know what I mean. There's no family. There's no support in the UK. Childcare is is something else. A new environment, trying to adapt to a new environment. Then I thought to myself the things that I did that helped me thrive during the first 2 years of my experience in the UK, how I was able to pass all the exams despite raising my children, working hard and trying to make a living for myself and my family. I was able to write this book, and it was just the things that I did, for myself.
Wow.
Bringing it out to people that you deserve bliss. You can be your best self no matter what the challenges you're facing. If you take good care of yourself, the 3 parts of yourself, like I mentioned earlier, your spirit, your soul, and body, if there's a balance, you will thrive, you will succeed, you will get to the peak of your career. Your self-care guide to everyday fulfillment. Consider it like a mental health Bible, something that you do. It has a lot of pages for journaling in it.
Okay.
You see?
Beautiful.
Yeah. You can see. Yeah.
It's
so
colorful and uplifting.
Exactly.
Yeah.
So it's very easy to read, very colorful. It's something that you can pick and literally finish within 2 to 3 hours. But most importantly, it's something that needs to be practiced every now and again. I go back to this book to read. When I'm feeling low, I go back to it to check it, to see what am I missing out. Because it's supposed to be something that will guide you every day.
Right.
To your life. Yeah, this is it.
Beautiful. Definitely. As a published author myself, definitely something to be proud of. I know that took a lot of commitment and dedication to just get it. Isn't it amazing when you have something in your head and you can manifest it into reality in that way?
Exactly. It is amazing. It is amazing.
Congratulations. Congratulations. So how could everyone get in contact with you?
Just follow me at talkmental.health. Just I think it's on there, talkmental.health. You can follow me, send me a DM. Our website is www.talkmentalhealth.org. Okay. So contact me on on our website as well. But I think that one of the easiest ways to reach me is via my DM, Aziza, right?
So right, yes. Exactly.
Just my DM. and then you will be able to reach me. Yeah.
So there is one question that I find very interesting, and it kind of go back to something we was talking about. Someone posted from it's your girl Remy. How does someone know when they are ready to accept the hardships of seeking therapy? That's a very subjective experience. A very
it is subjective, but I think for most people that I have the clients that I've had to deal with, I know when they are ready is when they show up.
Yeah.
So when you're ready, you will be the one to seek help yourself. Nobody is forcing you. You have internal motivation, if you get what I mean.
Mm-hmm.
You want to go. You will be the one reaching out. You notice you're not canceling your sessions. You notice that you be looking out for who to help you yourself, not mommy or aunt or sister trying to help you. You be the one seeking help yourself.
You're right.
That you are ready. And when you continue, sometimes you might even start and then get to the midpoint and you're like, oh, I thought I was ready, but I don't think so. This is too much for me.
Yeah.
So if you're able to cross that hurdle of, oh, this is too much, then it shows that you're really ready. But sometimes you might take a step backward and say, I'm not ready, and that's fine. So whenever you're ready, whenever you feel up to it, it's subjective, like Aziza said. You just have to go for it. But then I need to remind us that whenever we're ready, it will still be painful. I mean, keeping it, not talking about it, delaying it, or not showing it doesn't mean that the pain will go away. Anytime you go through it, you'll still feel the pain. So yeah, you get what I mean, Aziza?
Yeah. Yes, I completely agree. I find that from my personal experience, I mean, I was a psychology minor in college, and I do plan on getting my PsyD in psychology, but we have a professional here, so I will speak from an experiential perspective. I find when you approach something that's positive or is expected to have a positive impact on your life and it terrifies you, that's when you should do it.
Exactly.
That's been my experience. Yeah.
Face your fears. Like there's nothing that would numb me. I remember sometimes when I wanted to write one of the exams that I needed to become a psychiatrist here in the UK. It was so challenging for me. I wanted to delay. I said because I was not ready, and I just wanted to give it more time. But I got my encouragement that I just need to face it. Okay, so the worst is for me to fail this, and then I'll learn.
Right.
So I went and I passed the exam. So if you feel like you should not do something, sometimes that's the sign for you to go through it, because when you do, you will be glad you did. It's going to boost your confidence. You feel better. So in the context of trauma, so if you go through therapy, you will feel better eventually. It's going to be painful. The journey will definitely be painful. But if you've got a good therapist by your side holding your hands, they will teach you skills that would help cope with the painful part. Yeah, breathing exercise, a lot of things that you can learn on how to cope while you're going through the painful experience. And at the end of the day, you become better. You feel better at the other side.
Right. Yeah. Right. Your resilience builds up, and every step becomes easier to take. Mm-hmm. Mm-hmm. And I feel like it's never as bad as you imagine it to be. I think we tend to imagine like the worst of it. And
yeah.
Well, Dr. Adiola, thank you so much for your time. You have been such a strong voice on this topic, and I'm really glad that we was able to find each other on social media. Social media is good for. And congratulations on publishing your book. Definitely go and get it. It's available on Amazon, correct?
It's on Amazon. You deserve this.
You deserve this. Yes, most definitely. So take care of them, little ones. Thank you again for your time.
I will.
Yes, take care.
Bye.